Hello, everyone. Thank you very much for joining us in such great numbers, and we are very, very pleased to have you here. Sorry for the technical difficulties this morning, but I promise you, with the lineup of panelists that we have, it will have been worth the wait. So we are extremely pleased to welcome you here at the Health Pavilion for this event on the One Health Joint Plan of Action, which will specifically focus on integrating the environment into One Health, so one of the 6 pillars of the Joint Plan of Action. And I'm extremely happy to be able to welcome you here in this Health Pavilion with this beautiful sculpture, which is very much evocative of One Health, because it very much alludes to the ecosystems that safeguard and nourish all life on Earth. And it's also very representative of our lungs. So how that impacts upon our health. So I think that this is the perfect setting, if you will, to begin this exciting event. So I won't spend a lot of time, and I'm sure we can make up. I'm sure we can make up some time now. I won't spend a lot of time giving a long introduction, because we have a wonderful group of panelists that will speak to it. But maybe just to very briefly note that the One Health Joint Plan of Action was recently launched just last month, after a year and a half in the making, by the 4 quadripartite organizations, which are the Food and Agriculture Organization, the World Health Organization, the World Organization for Animal Health, the new WOA, and, very excitingly, also the United Nations Environment Program. So I think that the addition of the UNEP to this new quadripartite alliance for One Health is a real testament to the need to address those environmental determinants of health that we're really going to get to the heart to today. So just a quick note on the structure of the panel. We're very, very pleased to have with us from the Quadripartite Secretariat, Dr. Amina Beniaha, who will be delivering an overview. If you can look right here, there she is. We are very pleased to see her. Thank you for joining us, Amina. It's wonderful to see you. She will be delivering a presentation on the Joint Plan of Action for all of you. So without further ado, Amina, over to you.
Great. Thanks, Christina. Are you going to share it from your end? I understood that it will be shared from your end.
Yes. I believe we are sharing it from our end, and we should be seeing it very, very shortly. Right now, we see your beautiful smile. And the first slide.
If you go back to the previous one, just the title before this one would be great. Yes. Good morning and good afternoon, everyone. And yes, thank you for welcoming us to this session that, as Christina said, which will really outline our quadripartite joint work in developing and finalizing this joint plan of action. I just would like to start by saying that really One Health is not a new concept. We all know that it's already on the international agenda, but COVID-19 really strengthened its importance. I don't see my slides anymore. Is that okay? Yeah. So yeah, it was just to say that COVID really reminded us of the importance of working in taking this One Health approach with the increasing number of these multi-dimensional health, water, energy, food security, and biodiversity challenges. Really requires to take this One Health collaboration, coordination, communication, but also capacity building. So it has given us to FAO, UNEP, and WOHA really a unique opportunity to stand together as a global coalition to try to jointly drive and change and achieve the transformation that has been desired at the highest level. So we believe that this plan really provides a framework for all the countries, and we believe that it will strengthen their collaboration and also mainstream the One Health at global, regional, but also national level. And as you said, Christina, this presentation will very much focus on how the environmental challenges have been tackled when developing the plan, taking this One Health perspective. Next slide, please. So following this momentum, the 27th tripartite at the time, UNEP was not formally joining the tripartite. The annual executive meeting really agreed to jointly develop a strategy and an action plan that will help prevent the future zoonotic pandemic, taking this One Health approach. As such, there was a joint drafting team from the 4 organizations that was established in helping developing the joint plan of action. And we had input from our respective regional offices, but also we had several consultations with our member states, briefing them, but also taking into account their comment and observation. And I have to say that it was very positively welcomed, all the work that has been done. The One Health high-level expert panel that I don't need to introduce was created by the quadripartite last year, and it has really acted as a key advisory body while reviewing the process. They have had a key role in producing the definition on One Health, but also the theory of change that you could find in the document. So the JPA, I will say JPA to just yes, because I will describe it along the slide. So I will refer to the JPA was officially launched last month, and we believe that with this we will have a clear vision, commitment, and a concrete plan on One Health for the quadripartite. Next slide, please. So as I was saying, the One Health definition that was developed by the OLEP and endorsed by the quadripartite really describe how One Health cut across the boundaries of animal, human, and environmental health. And it really looks for a holistic way to understand how diseases emerge, spread, and how they can be prevented and controlled effectively and sustainably. This One Health approach calls for a collaborative and integrated approach with improved coordination and communication across disciplines, sectors, and groups in society at all levels. So such an approach really if we take this approach, we will generate an improved knowledge, we will strengthen the capacity building, we will develop plans for prevention. Prevention is a key word in the JPA, surveillance, event-based surveillance, early warning, indicator-based surveillance, but also response and control at global, national, and regional, and even local level. Next, please. So I will not go into details as the panel will discuss this, but this slide really shows you how the health and well-being of the environment is a really critical foundation for the health and well-being of humans, animals, and plants. Because every of the environment degradation has a direct or indirect negative consequences for human and animal health. We can take the example of land use changes, deforestation, biodiversity loss, and unsustainable agriculture production and intensification, among other drivers. They are really threatening the ecosystem integrity and really posing increased health risks at the human, animal, plant, and environment interface. So these risks are made worse by expanding urbanization and sustainable food production and consumption pattern, including increasing complex food chain, poor waste management and disposal, increased trade and travel, as well as the climate crisis. So to efficiently prevent and mitigate all these threats and maintain the ecosystem health, the biodiversity conservation, the environmental, public health, and animal health, they need to understand all these interlinkages, and they need to speak with one voice and really implement the One Health with a harmonized approach. Next, please. So in this slide, you see the core or the heart of the plan, that recognizing these famous 6 action tracks, which are very much interconnected, and they collectively contribute to address the key health challenges of the human, animal, plant, and environment interfaces. Describing quickly all of them, starting with the action track 1, it's really the umbrella. It's the overarching action track, and it really shows the importance of the establishment of this One Health capacity, the One Health workforce development, and the generation of an enabling environment where all these capacities can be used to their fullest potential. The second action track is about understanding all the drivers of emergence, the spillover and the spread of zoonotic pathogens, identify the key intervention, and also strengthen the surveillance, the early warning, but also the response systems. The third action track is about reducing the burden of endemic zoonotic diseases, neglected tropical and vector-borne diseases through this community-centric risk-based solution, strengthening policy and legal frameworks, and also increasing the political commitment and investment. The fourth one is about really focusing on strengthening food safety. And by this, we need to increase the awareness, the policy changes, and the coordination among all the stakeholders along the food supply chain. The fifth one is about all the joint action that we need to take to really preserve the antimicrobial efficacy for responsible and prudent use in human, animal, and plant health. But also, it looks at the equitable access, not only the access. And then the last one, but not the least one, and what is really most relevant to this session is the action track 6, that is importantly integrate the environment into the One Health, focusing on protecting, restoring, and the prevention of ecosystem degradation, mainstreaming the environment into the One Health, integrating environmental knowledge, the data, and the evidence in One Health decision making. Next, please. So this slide shows the action track in details, and I would like to also emphasize the fact that the environment component has been taken into consideration along the entire joint plan of action. But we have devoted one action track to the environment, given the importance and given that this area was not taken into account in the way we were tackling One Health in the past. So the objective of this action track is really to protect and restore biodiversity, prevent the degradation of nature resources and the wider environment, to promote the health of humans, animal, plants, and the ecosystem. This involves 4 high-level actions that you can see here. The first one is about protecting, restoring, and preventing the degradation of ecosystem and the wider environment. The activities that are under this action are really intended to promote and a shared and better understanding of the health threat posed by unhealthy environment to wildlife, to livestock, but also to people. The second one is about mainstreaming the health of the environment and ecosystems into the One Health approach in this effort to promote and support the development of One Health policies, plan, action that are more inclusive of the environmental sector. The third one is about integrating environmental knowledge, data, evidence into the One Health decision-making. The fourth one is about creating these interoperable One Health academic and in-service training programs for the environment, medical, agriculture, and vet sectors professional to strengthen the capacities at all levels. Next, please. So now with the launch of the recent launch of the JPA, we are currently working on developing the implementation plan, which will be tailored to really specific needs of each countries. It will align with the UN Sustainable Development Cooperation Framework and all the existing One Health tools. It's very important that to emphasize on the fact that we build on the existing and we do not duplicate by developing this plan. Part of the of developing this implementation plan, it will also involve the development of the monitoring and evaluation framework to be able to really to measure the progress of the action that will be taken. The quadripartite has established a funding task force who are really helping us costing and budgeting the plan in order to really enable the investment and the development of a resource mobilization strategy. There is also a communication task force between the four organizations that is very much engaged in developing this strategy and advocate for the work of the JPA. Next, please. So, as I said, by developing this implementation framework, the JPA, the Joint Plan of Action, really provides a good description of the scope of the work on One Health. But there is this need for a concrete operational framework for the countries in order for them to really translate all this high-level action into concrete activities at country level. So the implementation framework, by developing this, we are considering the existing One Health capacity within countries and learn from these and essentially aim to respond to the country needs while being adaptable of the needs from one country to the other. So we will consider the existing resources and programs, and we'll try as much as possible to align with this to optimize the resources that are already available. We will acknowledge the need for the JPA to avoid a one-size-fits for all approach, and really we insist on this stepwise approach that's tailored for implementing, that will take into considerations the need of the national, the regional, but also the local context. We insist on the fact that the plan will be evidence-based, and for this we will require on the advice of our panel of experts. The JPA will continue with its collaborative and inclusive approach by really engaging with all the stakeholders, and this includes the countries, so the different UN organizations beyond the quadripartite academia, the private sector, civil society, and other non-state actors to work together really to support the implementation of JPA. So the framework will also consider the role of communities and the importance of their involvement, and will also be important to ensure that we are able, as I said before, to monitor and track the progress of its implementation. Next, please. So you see here the three pathways, and that the implementation plan will be based on. These pathways are identified in the Joint Plan of Action as part of the theory of change. The first one relates to the policy that need to be adjusted, legislation to be established, accompanied by the adequate financing and advocacy. It should involve the review of the existing resources to see how the Joint Plan of Action is going to change the practices currently in place. The second pathway will involve the recommendation for the development of certain organization and the key role and responsibilities of each actor. And the final pathway relates to data. Data is key. We need data and the evidence and knowledge and how these all these connect. It's important to have a well-designed surveillance systems. I insist on the S at the end of systems that are interoperable and the data that can be communicated. Next, please. And I will I will end by thanking you for the opportunity to present the work of the quadripartite and by this historical moment where the 4 DGs of each organization signed the MOU in March of last year and welcomed UNEP as the fourth partner to form the quadripartite, highlighting really the importance of the environment sector and cementing our commitment to work together for the health of human, animals, plant, and the environment. And I thank you for your attention. Over to you, Christina.
Thank you very, very much, Amina, for that very clear, very thorough presentation of the Joint Plan of Action on One Health. I think that gives us a lot of food for thought as we move toward the implementation framework, toward the development of an implementation framework through the pathways that you had just indicated. And to do just that, we've got 8 terrific panelists that are going to be joining us. And I will briefly introduce them as some of them join me here on stage. Others will be joining us virtually. So please, those of you that are on the panel and are in this room, please join us on the stage now. And I'll also introduce myself. So my name is Christina Romanelli, and I work on biodiversity, climate, and health within the Department of Environment, Climate Change, and Health at the World Health Organization. I had the honor of contributing to the development of this joint plan of action over the past year and a half. And I can assure you it was a truly cross-sectoral and multidisciplinary endeavor of many, many people. So some of which are here with us today. And the first of which I'm very pleased to introduce will be Dr. Maria Neira. She is the director of our Department of Environment, Climate, and Health, and she needs no introduction for any of the events here at the Pavilion. So, Maria, can you please tell us, environmental determinants in the operationalization of One Health are often still very much underexplored. So what is it that we can do to ensure that they are all fully integrated at all levels of collaboration in One Health, at the community, at the national and the international levels? Just a few thoughts. And before you begin, Maria, I know we can all be very passionate. We are hoping that this is a rapid fire session, so if we could limit this to 2 minutes, it would be ideal so that we can ensure that everyone has a chance.
Thank you, Christina, and thanks for giving me the opportunity to intervene from far away. It will be lovely to be there with you. Just a few thoughts. One, the work on environmental determinants of health, as you know, started long time ago with the estimation of what the environmental risk factors represented for health. 25% of the global burden of diseases is linked to environmental risk factors. So this has to stop. The collaboration with UNEP and other partners on environmental health is very important. And we will be definitely expanding and working even much more with them. And then the other thing I would like to stress is the fact that all the work that we need to do now to tackle the causes of climate change, most of this work on mitigation is very much the work that the environmental health community has to do. So if we are very pragmatic, following the interventions that have been already well defined, maybe, Christina, you can as well mention later on the compendium of environmental health that has been done in collaboration with our colleagues and friends at UNEP. I think if we put all of these interventions well aligned with the willingness of establish this collaboration and taking into consideration that this can contribute as well to tackle the causes of climate change, I think we have a very good opportunity for protecting biodiversity, having very strong arguments to stop the deforestation, having a campaign to stop the destruction of the ecosystems and then protect nature, make the interventions in the places where we need the most, and then aligning the results to use those results to further motivate us to go for more action. Cristina, I will stop here because I know that you have a very exciting panel, so I will love to hear from them. But tell you that we are our piece on the three pieces: environmental health, animal health, and human health. Our block, our pillar on environmental health is prepared, is committed, is engaged, and of course we will be very happy to work on partnership to make sure that our impact will be the biggest as possible, and of course contributing the best as possible to this huge challenge that we have in front of us. Over to you, Cristina. Thank you.
Thank you so much, Maria, for that very dynamic and compelling response to the question, and also for reminding us that, in fact, it is true. 1 in every 4 premature deaths is attributable to preventable environmental factors. So I'm sure no one in this room needs any convincing that we absolutely need to have and implement a robust multi-sectoral and cross-sectoral approach. Thank you, Maria, for that. And we look forward to your further thoughts as the panel progresses. Our next speaker, another member of the Quadripartite Alliance for One Health from the Food and Agriculture Organization, is Dr. Zitouni Ould Dada, who is the Deputy Director in the Office of Climate Change, Biodiversity and Environment at the FAO, leading its coordination of climate change and energy work stream. He's also currently member of the UN COP27 task team established by the UN Secretary General to offer one UN support to the COP27 Egyptian presidency. So, Dr. Ould Dada, do we have you online?
Yes, I am. Can you hear me?
Yes, absolutely. So, welcome to this event, and we very much look forward to you sharing your insights as well as to how we can better integrate the environment across all levels of governance, be it at the national and regional and global levels. Thank you.
Thank you very much. Thank you for this opportunity, and it's my privilege to add to the gender balance, at least on screen, from what I can see. So thank you for the opportunity. It's really nice to reconvene with colleagues again to talk about this important issue. And Amina have set the scene nicely in identifying, the challenges and the opportunities, and it particularly the issue of integrating the environment more. I think this is obviously critical because things in the real world are interconnected in that way, and we have to reflect them in our work and through the One Health that provides this opportunity and this platform to show that. Just to share with you a couple of things of how we are reflecting this in FAO's work. We have a new vision, if you like, a new strategic framework for the next 10 years that is based on priority program areas. And one of these priority program areas is on One Health. That can really shows, the multiple streams we're working on, also the connection between animal, plant, environmental, and human health. And at the country level, we're also reflecting that, to support the countries to review, to update and implement the relevant policies and measures and plans that shows the integration of these dimensions of One Health. And I think one thing to also emphasize is that, we're dealing with a complex relationship. All these dimensions are complex by themselves, and then bring them together become even more complex. That's why we really need to focus on some key aspects that can make sure they are addressed in that way. One final point for me I want to emphasize on is really the better communication in these aspects. We need to go beyond just the experts and providing information on the One Health to the experts. We need to go beyond that to not just to the different ministries, so that there is that the interconnection. I think that's critical. Also to the public at large, really to realize the intersection between and the connection between these key aspects that are forming the One Health. And I think Amina mentioned the data and the metrics as well, and this really goes without saying. So for me, it's really a communication aspect to go beyond just our sphere of experts and the concerned parties, but to promote this at large, because it concerns people, it concerns everyone. Thank you. Back to you.
Thank you very much, actually, for all of those insights. Yes, absolutely. One Health needs to be inclusive. It needs to be multi-sectoral, and it certainly needs to go above and beyond the experts. We need a whole of government and also a whole of society approach for One Health to be effective. I'm also going to give Dr. Chadia Wanous, the One Health Global Coordinator at the World Organization for Animal Health, and of course also Diana Kopansky, who is a Program Management Officer and Global Peatlands Coordinator at the United Nations Environment Program. The opportunity to come in on this exact question. Now remember, this is a rapid fire question, so I'm giving you each 2 minutes to maybe respond to how can we accelerate these efforts.
Thank you, Christina, for having us and for organizing this side events on integrating environment into One Health. From the World Organization of Animal Health, WOHA, formerly OIE, we have a lot to do to accelerate this integration of environment. As you know, we are a normative standard-setting scientific organization, intergovernmental organization with member countries from 182 members. So our role is to integrate environment into all of our standards, into all of our codes and norms that we provide to countries to strengthen their animal health services and veterinary services. And I would like also to highlight the issue of the One Health platforms, that we are strong advocate of this. And we have in the plan to strengthen this multi-sectoral coordination mechanisms at all levels, starting from the regional to the country level. And for that, the environment sector should be an equal partner sitting at the table with us for animal health, human health, and other also sectors that are relevant to the One Health, like the finance, the development, the planning sectors, and the conservations and wildlife authorities. And the second aspect, it's about promoting our climate smart agriculture and vet services. We all have a role to play here to reduce the greenhouse gas emissions. From the animal health sector, we can do this by making our services more climate smart and environmentally sound. And we can do this through the training of our health workforce along with the environment sector and human health. We can also invest in energy and infrastructure and technology to reduce the emission. I will stop here and we'll continue later. Thank you, Christina.
Thanks so much, and I must say I'm really pleased to be here with you. I'm representing my colleagues that are back in Nairobi and didn't make it to the COP, but I've been working also on health and environmental issues for a long time, and the United Nations Environment Assembly, which is universal membership, had the first very ministerial dialogue on a healthy people and a healthy planet way back during UNEA 1. So there is something that we're building on. This is not new, as Amina mentioned, but the thing is that the approach is new and that we're in a phase of action. I want to just say it's not actually complex, because I think what we try to do is also try to understand it from our different places and spaces. But we're all people, and we depend on nature. It's the food we eat, it's the water we drink, it's the air we breathe, and it's the places that we live and those places that we love. So I want to just boil it down to that, and that means everyone needs to get back to prevention, get the healthy relationship with nature, and really understand the impact of their decisions. And the work that we all do collectively needs to be done together. That's what we're in. We're in an absolute climate emergency, we're in a nature emergency, and we're in a pollution emergency. And unless we know that we're standing on the earth and interacting with nature and understanding that relationship, we're not going to get very far. I also want to just compliment on the One Health approach. UNEP's goal is to really ensure that we fully understand and act on these overarching drivers of health risk. This is climate change, land use change, environmental degradation, deforestation, peatlands drainage and degradation, and loss of coasts through mangrove erosion, loss of corals. UNEP's actively engaged and really proud to be part of the One Health initiatives, including with the quadripartite alliance partners at the regional level. And as part of the One UN group, we also support through the integration of environmental sustainability through the UN country teams. So we also have a very global normative role. We bring the best science to policy to make decisions and take actions. And I want to share a little bit about one of the enabling factors, what can really get us to jumpstart it. Some of the challenge that has shown that we're not dealing with root causes behind the changing health risk profiles. We need this focus on prevention, and we need more multi-sectoral engagement, of course. But we also need action by all. And together with partners, UNEP recently launched the Nature for Health Fund. It focuses on investments in nature as a basis of reducing the risk of pandemics, but it goes wider because Nature for Health is working nationally to prevent pandemics, but also related health issues. Through an initial contribution of 50 million euro from the International Climate Initiative of Germany. This is where nature-based solutions is coming to the forefront, not only on climate, but health and for people.
That's terrific, Diana. There is so much to say. Clearly, it can't be summarized in a rapid-fire 2-minute session, but we will have the opportunity to unpack some of the richness that you've provided, to talk maybe even about the Nature for Health Fund, multi-partner trust fund, to which you just alluded. But we also are very, very happy to have with us a representative from the Ministry of Environment of Egypt. And we know that you have very little time and that you must leave very shortly for prayer. So thank you very, very much for staying, and maybe you can answer some questions. For those of you who don't know him, his name is Dr. Ayman Hamada, and he's currently working as Undersecretary at the Ministry of Environment of Egypt and head of the Biodiversity Central Department. He has a proven career in the field of biodiversity and protected area management, and more than 25 years of experience in establishing and managing protected areas, wildlife monitoring and conservation, and the sustainable management of biodiversity and ecosystems. And you know, it's very exciting to be able to have you here with us, because I think you can provide us a lot of insight Now that we've got that framing from the global organizations of what the current situation is really like for One Health implementation at the country level. So what is it that you can tell us about that? And are there any particular challenges and opportunities or lessons learned that you still have time to share with the panel? And what factors influence whether the health of the environment or One Health receive priority in policy settings and in finance?
Thank you, Christina, and a special thanks that you didn't remind me or ask me to make it very quickly in 2 minutes. So this means that I can take my time. Okay, thank you. Actually, I have to thank the Quadripartite Secretariat for giving me the opportunity to be here with you in this important side event, discussing one of the critical issues, which is integrating the environment in the One Health approach. If I'm going to, if I want or to talk about the current situation in my country, in Egypt, very simply and very shortly, we are doing well on the implementing the One Health approach in Egypt, and we are doing very well on integrating the environmental pillars, environmental aspects within this approach or within this scheme or system in Egypt. Actually, the One Health approach, you can date it back to 2011 when the Ministry of Health established what is called the four-way link task force. And the main purpose at that time was to share data between the Ministry of Health and the Ministry of Agriculture concerning the avian influenza. And of course, the Ministry of Environment was engaged before that, starting from 2006, when we started to have the avian influenza in Egypt, and when we started to do surveillance to monitor the avian influenza status in Egypt. And this four-way link task force evolved to what is called One Health Technical Advisory Group, and I'm part of this technical advisory group. And it evolved to that technical advisory group when they decided to get in to bring with them the Ministry of Environment, the academia, and other stakeholders. So now we are working very well to prioritize our zoonosis, our AMR situation in Egypt and the strategies, and we are giving the advice and technical advice to the government, to all the partners. So we've updated and the National Action Plan for the AMR. We've also already finished or already done with a strategic framework for eliminating rabies in Egypt by 2030. And finally, we are in the final process, on final stages, to finalize the national One Health strategy. And we were planning to launch it during the COP27, but unfortunately we couldn't, but it will be launched very soon. I think Dr. Naima agrees with me that it will be launched very soon in the coming weeks or coming months. And after we launch the One Health strategy, we are going to prepare the action plan. And of course, we will secure the fund and finance to implement, because the issue is about the implementation. And this will bring me to talk very briefly on the challenges. There are many challenges, of course, but maybe one of the most important, on the top, is the institutionalization, how to institutionalize the One Health within the governmental actors. And this is one of the key challenges, actually. We are working on that. We are bringing many ideas as a One Health Technical Advisory Group to the government. And I can say that this is also, it could be one of the opportunities. I can see that we are gaining political interest and political support. Many factors. There are many factors that help us to gain this political support. Our prime ministers and the cabinet of ministers are supporting the One Health approach and the One Health strategy. This is why it is one of the opportunities that we can make use of. Going back to the challenges, because we do have a good coordination at the level of experts and at the level of the technical advisory group, but we still have some problems with in the implementation. We still have some problems related to the lack of coordination at the level of implementation, because we do have other committees, other national committees that its mandate is overlapping with the technical health, with the technical advisory group. So we still have some challenges, but we make use, we want to make use the current opportunities like the political will, like the support of the quadripartite alliance, and of course the offices, whether they are regional or country offices of the WHO, FAO, World Organization for Animal Health, and even the UNEP. So this is also an opportunity to help us to try to overcome our challenges. We have many success stories and many lessons learned, but the most important lesson, because I'm working with the environment, I'm working with biodiversity in Egypt, is that we all know, that's not only in Egypt, and the whole world know that there is no way to avoid the future pandemics without integrating and strengthening the environmental pillars in the One Health. No way. If we don't integrate and fully strengthen the environmental way, I can assure that the COVID-19 is not the last one. I'm sorry to say this, but this is true. This is true. I can speak on this issue for hours, but because for the sake of time, that maintaining biodiversity, maintaining environment is not a luxury anymore. Protecting the environment is protecting our existence in this planet. Finally, to gain the political will and to move the One Health on the top of the political agenda, I think it is easy now. We have the support. If it is easy, because if you look at it from the perspective of the policy people, it depends upon their policy, upon their perspective, their awareness, and their beliefs in One Health. And this can be changed if we have a powerful and actors or implementing actors like the WHO, the Ministry of Health in Egypt. It is a main actor, so it depends also on the strength and the power of the actors and the leading actors. It also depends upon the support we gain. If we have global and regional frameworks, this will also support to change the political perspective and to help us to move the One Health to the top of the political agenda. I have a lot to say, but for the sake of time, and also I need to leave quite early, so I have to wrap up here, and thank you for giving me this opportunity once more.
Well, thank you very much for that very powerful account. I think we really appreciate that you said there are still some challenges. Those challenges are related to implementation. But in speaking of those challenges, you move directly into opportunities. And that's exactly why we're here. Because there is an opportunity to more meaningfully integrate. And it's, as you said, Mr. Hamada, it's not a question of whether the environment is relevant or sometimes relevant or increasingly relevant. Absolutely not. The environment is always relevant because we live in this environment. We live on this planet. and the way we manage it will modulate our health outcomes. So thank you very much for sharing that experience. It will give us a lot of food for thought, I think, here around the table. And I'd like to go back to climate change. When we're thinking about climate change, we're here at COP27 all discussing climate change. So how can climate change challenges support the health of people, animals, plants, One Health, really, and ecosystems underpinning sustainable development? So maybe from an environmental perspective, I'd start with you, Diana, to say a few words on that dimension first, and then we'll move to all of our panelists that would like to say something about it, both online or in present.
Thanks so much. Yes, we've heard and the impassioned discussions and calls for action from our United Nations Secretary General. It is an absolute climate emergency. Climate's already causing droughts, floods, fires, heat waves, and other impacts, and the impacts of as well those fires for air pollution, for also loss of lives, loss of children's education, loss of caregivers' opportunities, employment. If we really cost the impact of our actions on land degradation, deforestation, and agriculture and agricultural expansion, it is devastating. So I want to just let you know that unless we really get back to that both immediate, rapid, large-scale reductions in greenhouse gas emissions to limit the global warming to 1.5 degrees, or at least 2 degrees, then we're going to be beyond reach from a health and planet emergency. And that means decarbonizing our economy. That means making different choices in the food space. It also makes making different choices for the health of our soils, and also making different choices on how we move around on this earth and interact with it. And between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year. That's only from malnutrition, malaria, diarrhea, and heat stress. So that doesn't talk about air pollution. It doesn't talk about other diseases like zoonoses. We know that many pathogens like dengue fever, West Nile virus are linked to climate change and impacts. And so we need to look at how the actions on the ground can resolve, when we, for example, when we re-wet our wetlands and re-wet our peatlands, we need to consider this. But if we don't do that action, we won't make our greenhouse gas emissions reductions. So there are trade-offs, but there are solutions. It's not one over the other, but as you said, environment as an equal partner in the quadripartite. And although we've been working together for a while, I think that's a very big signal to the world. And we also see nature coming strongly into the discussions and dialogues, both here at the COP, but also in the G20. Some very strong outcomes on nature, including at UNEA earlier this year. We have a resolution on nature-based solutions. We had a resolution on biodiversity and health. We had also on zoonoses. So all countries in the world are paying attention, and all people in the world are also paying attention. One thing I also wanted to just say that there are 3 dimensions of sustainable development, and that includes social and economic aspects. However, we're not costing the true cost of our decisions. Just an estimate, the direct costs, damage costs to health are estimated to be 2 to 4 billion per year by 2030. And this is for areas that have weak health infrastructure. We're talking about Africa, where people don't have access to clean water or even health services. And I think that this joining up, it's about empowering your teams and my teams to actually take that knowledge and also know that we're together in it, that you can count on the technical expertise from UNEP, and I can count on the technical expertise and the connections and networks. And I think for me, this climate emergency, if we don't act now, we've got 10 years to make it right, and we've got to go together. It's collaboration, not competition. And unless we get that right, that we bring everyone to the table at speed. We need more time to talk. We need more time for networking. It's a really important thing that we may have lost on our drive for expertise, on drive for data. Actually, we just need these opportunities to talk. So talking actually inspires action and inspires people to actually have a purpose for a green and meaningful future. Thanks.
Thank you. Thank you very much for that, Diana. I'm just going to give the opportunity to some other panelists, turning to maybe first to the ones we have here virtually, because it's harder for me to see which ones would like to intervene. So if anyone of our panelists,
Cristina, if I
Maria.
may,
Okay.
because I have to go. I'm so inspired by what the panelists are saying. Fantastic interventions. Thank you so much. I think the representative of the Ministry of Environment in Egypt has been absolutely clear on what are the next steps. Several things are positive here. One, I think we are all extremely convinced if we do not protect the environment, there is nothing else we need to discuss about it. And I think we are very much convinced, all of us, of the importance of this collaboration, not competition, but at the contrary, contribution, collaboration, aligning our forces. You know, in Spanish we say, la unión hace la fuerza, which means together we are stronger. And this is exactly what this quadripartite is about, it, making sure that at the political level, the case for addressing the basic determinants of our health, coming from the environment, coming from the animal health, coming from human health, is extremely important. Cristina, my last point, if I may, to all of you is, we are very much engaged, but in addition to that, I think this is probably the biggest opportunity ever to do a massive primary prevention enormous campaign. So I think this is the moment we have been waiting for it. The results can be excellent in many, many fronts. So thank you very much for this opportunity, and over to you.
Thank you very much for always inspiring words, Maria. The greatest opportunity ever for focusing on primary prevention, for a primary prevention campaign. That is very, very compelling. I will also turn to our panelists seated here. I believe, Shadia, you could certainly say a few words to this. I don't mean to put you on the spot, but...
Thank you so much. Just building on our colleagues, what they have said about prevention. It's of utmost important now to seize the opportunity, because we have this recognition of the environmental determinant of health and the drivers of risk of pandemics. But we need to go a little further and quantify the risk. Now we understand the drivers, we can list them, but we need to quantify them, and for that we need the academic and research institution support to have our OLEB member advising us on this as well, and other scientific advisory groups. And also we need the economic analysis, how much it will cost to prevent. And we have some estimate that prevention costs fraction of the response, for example, to COVID-19, which cost us, in addition to life lost and education and productivity, the economy lost trillions of dollars in income and product and services. But prevention costs just tenth of this amount that we have. And also from the animal health side, we know that if we invest in reducing the emission from agriculture intensifications, we can have a lot of co-benefits to human health, to the environmental health. So we need to take into account this co-benefits when we do our interventions. And lastly, it's about the integration and the alignment between our national One Health plans that Egypt mentioned that they are in the process of doing, with the global joint plan of action that Amina presented to us at the beginning of the session. But importantly, to integrate it into the national or contribution for climate change and the national biodiversity plans for countries. So this integration between the sectors should happen at policy level, strategies, plan, investment, and also at the research area. Thank you, Christina.
Oh, yes,
Of course. One last reflection or a very quick comment, because we are here talking about the climate change and how the climate is affecting our environment, as also is affecting our health, like has been mentioned by my colleague here. But one of the aspects that I want to highlight or to reflect on is that we all know that the climate change and the biodiversity loss and degradation of ecosystems has making tremendous changes in the distribution and range of all well-beings or animals or all the living or the living species on our planet, including the vectors, the disease vectors. And this, of course, will cause us to be more closer to maybe new vectors that are carrying some vectors, some viruses, bacteria that we are not familiar with. This is also one of the aspects how it is important to take care about the climate and the biodiversity and about also the ecosystem degradation. Finally, of course, I forgot to say that our national strategy for One Health is in line, and it will be aligned with the joint plan of action, the global joint plan of action. This is for sure. And as I told you, hopefully we'll launch this very soon, inshallah. Thank you.
Well, thank you very much for sharing that terrific news. So did we all hear that? Quadripartite Secretariat. We've got a very first joint a national One Health plan that is going to be aligned with the joint plan of action on One Health. This is great. You can lead by example. It is already. It is already. Perfect. And Shadia, you had also noted, we also need to heed advice from our members of the One Health high-level expert panel. And that is precisely what we will do right now. One of the members of the One Health high-level expert panel, Dr. Catherine Mashalaba, is here with us. She is also working. She is the principal scientist for health and policy at the Conservation and Global and Health Organization, the EcoHealth Alliance. She was also the lead author of the World Bank's One Health operational framework. And there are so many accolades that I can't possibly mention them all. But we have a lot of ground to cover with you, Catherine, and a lot of questions for you. So knowing One Health policies, strategies, and actions should be evidence, data, and science-driven. And noting also that one of the pathways highlighted in the theory of change that Amina beautifully presented to us earlier really underpins that One Health joint plan of action is about strengthening the scientific evidence base and knowledge translation into data for evidence. How can we fully integrate environmental and climate knowledge, data, and evidence from the environment sector into One Health decision making? So let's start maybe with that first part of the question, which I'm sure will provide a rich response. Thank you for being with us.
Yeah, thank you so much. It's really an honor to be with you, and thank you for all of the great work everyone is doing to bring the environment really to the forefront of our health protection policies. With OLEP, we have really been focusing a lot on equity and making sure that the sectors that need to be really built up to have an equal role in One Health decision making, including the environment sector, including veterinary services, really get the resources and the capacity strengthening and coordination that they need. And I think there are two areas where this becomes very practical at a country level as well as a global level. The first is related to what our colleague mentioned with decision making, so land use planning and impact assessment and safeguards, and making sure that the consequences to environment, which of course directly and indirectly impact our health of humans, of animals, of ecosystems, really that those costs are built in and we can adequately assess the trade-offs and co-benefits of different development decisions. So very broad scale. And then really at a more context-specific, localized level, when we look at climate-sensitive diseases, and unfortunately we're seeing that many diseases are climate sensitive, not just vector-borne diseases or zoonotic diseases, but really across the NCDs and communicable diseases, and with many cascading health impacts and economic impacts. But when we think about the systems in place, we heard about interoperable systems, about data integration, and sometimes we don't know what the relevant pieces are until we really get started. And I think we're seeing this more and more about the value of environment sector inputs and the entry points then, both for understanding the risks, the vulnerabilities, the impacts, and then also identifying the solutions. I'll just take an example of something like Rift Valley fever. This is, of course, climate sensitive. But when we really look, there's climate information that's important, changes in rainfall patterns, but also vegetation, soil science, vector ecology, livestock, veterinary services, human behavior, farmer associations and their practices, vaccine production. We really need that One Health approach to have some lead time to identify when risks are increasing and take the appropriate actions to reduce risk. So think that I'm very happy our colleagues mentioned the One Health coordination platforms, because these are active and these are growing, and we need to make sure that really across the environment spectrum, all relevant agencies and mandates are included in that, including from the climate agencies, which may be different than wildlife and other agencies in terms of mandates and resources. So full integration of environment, I think we're seeing that more and more, but we have to continually advocate and share best practices. So thank you again for the wonderful work everyone is doing, and I look forward to continued collaboration.
Thank you, Catherine, for always very rich insight. Might I delve a little deeper with you just for one more question, follow-up question? How can the data really be better incorporated to build more collaborative surveillance and predictive systems to identify hotspots for zoonotic spillover?
So we heard about changes in distribution, and this is, this is crucial in terms of making use of existing information from biodiversity monitoring, really getting a sense of how things are changing in real time. I would also say that migration data, human and animal migration, including people moving with their livestock and new environmental exposures. We need to be looking at this in a really comprehensive way. And at a country level, at a regional level, at a subnational level, these context factors become very clear in terms of where you may have those vulnerabilities, where you may not have adequate water, sanitation, hygiene, infrastructure in place. So I think, getting started with that basic mapping of where people and animals are moving, what the interfaces are, so we can get a better sense of what the hotspots for disease emergence are, as well as hotspots, where we have endemic diseases that cause really ongoing burden, and then get a sense of where we need to target prevention resources, engaging communities, ideally with biodiversity, sensitive risk communication on public health threats, but also on environmental protection. I think it's really investing in these systems and scaling them up. There are so many good examples of where this data integration is happening very effectively, and we can target the hotspots and the sources of risk, but this has to happen at a much larger scale, and we can't forget the important role of the environment sector in doing that.
Thank you so much, Catherine. There are indeed so many great examples of data integration and of application and operationalization of One Health, many of which we could continue to share for hours on end. Unfortunately, we don't have that kind of time. But we will take the time to ask each one of our panelists here to say a few closing words to inspire us, to continue to work together as we move toward a plan for implementation of the Joint Plan of Action for One Health. So maybe I'll switch things up since we've got I will start with you because I know, Mr. Hamada, that you need to leave, and then I will move to our virtual panelists.
Okay, actually, in very few words, I think it is very simply, it is time now to implement. It is now the time to fully integrate the biodiversity and environmental pillars in the One Health approach. It's time to implement the One Health strategies at the national, regional, and global level if we want to avoid the future pandemics. That's it. Very simply, we need to stop talking we already have national plans and strategies at all levels. So now we need to take these national plans and strategies into force. We need to implement. That's it, very simply.
Very nice. Let's move toward implementation. You will get the last word. So I will now turn to our virtual panelists. Any last, do we still have you there? Any last words of wisdom that you would like to share with us? Wonderful. Amina, please. Yes.
Thank you, Christine. I think that listening to this honorable audience, we don't have any doubt on the role, the critical role that the implementation of One Health, of the environment plays in One Health. But I come back to my, I would say not my, but our joint plan of action, because Maria said we have here a unique opportunity. We have a framework that brings all the sectors together, and we will work all together to operationalize the One Health approach. This action track on environment gives us the mandate, the activities that need to be done by the environment sectors, and we will continue at global level, having now UNEP with us for the first year, and WHO is chairing the secretariat. So we will continue working with FAO, with UNEP and WOHA to ensure that the rollout and the implementation of the One Health Joint Plan of Action will have the inclusion of the environmental dimension. Thank you all.
Thank you very much, Amina, for restating the commitment to ensuring that the environment will remain an equal partner in as we move forward in all the One Health efforts for the Quadripartite Alliance. And I see that Dr. Ould Dada has his hand raised, and we very much look forward to your insights.
Thank you. Thank you for this great discussion. There's a lot really to take forward. I just want to emphasize one point, particularly on the relationship between the climate change and the One Health. I think would be important to really reflect the sense of urgency that we have in the implementation of One Health. And one example I would bring into the linkages between the climate crisis and One Health is to address the resilience of the ecosystems, the resilience of the agri-food systems, the component of One Health, in addition to the connections we talked about, the various objectives that need to be achieved. We don't have enough resilience in our system. So I think for me, it's not only about decarbonizations, but adapting to the new reality and looking to the long term to build the resilience. Thank you.
Thank you very much for raising those important points. The need not only for, while we are at the COP27, so not only for climate mitigation, for actions to mitigate the impacts of what we are doing, but also to adapt, which has been a very recurring theme throughout the course of these negotiations, if we will. And now I would like to also, are there any other virtual panelists that would like to say a few closing words? Catherine, would you like to? Wonderful. I see your hand raised. Perfect. Wonderful.
Thank you. Just to highlight, the valuable discussions from COP27, we have to bring them to COP15, the biodiversity convention next month. And really, the cost of inaction is so high, and it's high for future pandemics. It's high for biodiversity loss, it's high for climate change, and we have to really address these in tandem. And we can't do it alone. We need the financing to be aligned. We need the coordination to be aligned. And I think that's a crucial message in terms of the opportunities and the synergies and getting there together with the existing resources and new resources and making sure that that alignment is really built in and that we don't leave out any of those three crucial areas. So prevention, but for multiple goals. And I think the joint plan of action really elegantly brings those together and is a great guiding framework. So thank you again so much.
Thank you, Catherine. And now we move to our other panelists that are here with us. Shadia.
Thank you so much. I would like to end on a positive note, as my colleagues, that we can do it. And we have the framework in the Joint Plan of Action. We have the mandate in the quadripartite, the 4 organization, to go forward in this implementation of One Health with our regions and countries, but we can do it alone. We need the partners, we need the actors, we need the societies, and we need the academia and the private sector and all relevant stakeholders. So please join our hands and let's do it.
And the last word to the UNEP.
Thank you so much. So I really appreciate these conversations, also being here today in this beautiful pavilion, which is also enhanced and enriched through artists' interaction. We're people, we need inspiration. So I think that that's also an important partner to bring along with the local communities that have an intimate relationship with nature, the indigenous people that have a different and a deep way of knowing. And I think that it's very clear we need to get to action, and we are already acting, but we need the resources. So an investment in One Health is not only a good investment for the environment, but it's an equal investment for a secure global health for everyone. I want to just emphasize this is going to help us get closer to the future we want and the SDGs. But nature takes time to heal. So we don't have time to wait. We are together. Let's act now. And thanks so much for having us.
So with that, I thank all of you for your patience. I had promised that although we began a little late, it was going to be worth the time. And I think that our wonderful group of panelists have proven that that is the case. So I would like to thank all of you, and I would like to thank all our panelists and those of us who have joined us online. Yes, we now have an important opportunity for action for One Health moving forward. We can take it from here to the next conference of the parties, as Dr. Mashalaba was saying, on biodiversity, which will be taking place next month. But then, really, it's about implementation on the day-to-day. It's not just about speaking and going from conference to conference about the value of One Health, but really sitting down together for an inclusive, multi-sectoral and multi-stakeholder dialogue. Thank you all so much for being here. Thank you.
Thank you. Bye.
Thank you. Bye.
Welcome everyone to World Health Organization Pavilion. As an engineer, I'm pleased to be moderating this session. My name is Samira Blushi. I'm the head of Omani Youth Delegation both at COI and COP, and I'm glad to be here on Health Forum on Youth and Climate Change in World Health Organization Pavilion on COP27. In my role, we agreed to ensure healthy designs for healthy, sustainable villages and cities. And as a youth, we all aspire to healthy air for all. As behind me, you can see a beautiful sculpture of a lung that represents the importance of breathing fresh air and being alive. I'm honored to moderate this session today to bring the results of series of engagements that have been done by youth from around the world, contributing their voices to shape decisions and bring solutions to protect our planet. This is built on 2 global virtual sessions by Global Youth Forum on Health and Climate Change and virtual survey beside dialogues at COI under the patronage of Excellencies Ministers of Health and Population and Youth and Sport in Egypt in collaboration with Dr. Tedros Adhanom, the World Health Organization Director, General and International Federation of Medical Students. We'll be starting today's session with an opening speech for the spokesperson for the Ministry of Health and Population in Egypt on behalf of the Minister of Health and Population, Dr. Khaled Abdel Jafari. Doctor, we cannot hear you. Could you try to...
Can you hear me now?
Can hear you now. Please proceed.
Good afternoon, everybody. On the behalf of His Excellency Dr. Khaled Abdel Ghaffar, Minister of Health and Population, Arab Republic of Egypt, I'd like to begin by saying it has been an honor to undertake this joint patronage with my peer, His Excellency the Minister of Youth and Sports of the Arab Republic of Egypt, Dr. Ashraf Sobhi, and Dr. Tedros Adhanom, Director General of the World Health Organization, working with partners to encourage and advocate for the voice of the youth in decision-making for health and climate action. The Ministry of Health and Population has been keen on establishing the Global Youth Forum on Health and Climate. Through youth can have a platform to voice their innovative solutions and be at the heart of decision-making. Youth constitute a large percentage of population in our countries and have inspiring and creative solutions. This platform allows them to discuss and protect their health, the health of their families, and the health of the climate for generations to come with the lens of justice and equity. I'm proud to be a part of this forum. We will continue to support World Health Organization as well as youth stakeholders, including all health professionals, students, and all supporters and development partners of health environment under the slogan of One Health for All by All. Let us work on implementing practical solutions based on evidence in the period between Sharm el-Sheikh COP27 and up until COP28 in Dubai. Globally, there is a well-known saying that the youth is the future. In Egypt, under the leader of His Highness Abdel Fattah al-Sisi, the President of the Arab Republic of Egypt, we also believe that the youth is the present. They are not only the future, they are the future and the present. Thank you all.
Thank you, Dr. Hussam. I think we youth all agree with Dr. Hussam Abdel Ghaffar that we aspire for actual practices and changes. Now we're going to have a video by speech by World Health Organization Director General. Thank you.
Your Excellency, President Abdel Fattah al-Sisi, Excellencies, dear colleagues and friends, Assalamu alaikum wa rahmatullahi wa barakatuh. More than half the world's population consists of people under 30. The future belongs to you. Your talent, ideas, and energy are essential to meet the challenges of today and tomorrow, including climate change, pollution, and health. WHO is committed to meaningful youth engagement, and most recently, we have established the WHO Youth Council to make sure young people are involved in shaping the future of global health. WHO welcomes young people with different expertise from different countries and organizations to be part of this network. Although young people are less at risk from COVID-19, the pandemic has disrupted the lives of young people in many ways, from education to employment opportunities and mental health. 2022 must be the year that we end the pandemic and accelerate progress towards the sustainable development goals. As we respond, recover, and rebuild, young people have a vital role to play. This World Health Day and World Youth Forum are a perfect opportunity to nurture new ideas for building a healthier, safer, fairer future, to building back together. Shukran Gazilan. I thank you.
Hopefully this year will be the end of the pandemic, and the perfect example of having youth being part of World Health Organization is me moderating this session with no experience, so thank you. Next, we're going to have a speech by Dr. Maria Nayera, Director of World Health Organization, Department on Environmental and Public Health.
Dear all, thank you very much. It is such a pleasure to have been working with you, knowing you, see your engagement, your commitment, your dedication. My words are just to let you know how much we are proud of you, how much we need you. You heard from the Director General of WHO, from Dr. Tedros, that you are the future. The future is on your hands, but the future will be as well what you will help to design for healthier conditions. And in that sense, we are really very happy to be able to work with you on tackling the causes, the obstacles that are now representing a major challenge for having a future healthier generation. We need you on being activists. We need you on keeping the pressure that you are putting on the governments. We need you to be constructive activist. I know that in addition to protest, to put pressure and influence in governments, you are already as well leading the change we need. And we need you as well on making sure that you will be the professionals of tomorrow, the ones that they will not be doing the mistakes that we are doing at the moment. So on all of those fronts, you are the ones that are giving us hope. You know, a few years ago, I met a group of moms fighting for clean air, and I thought, wow, this is a major achievement, because when mothers fight for the future of their children, this is very, very powerful. But now when I see as well as students, young people fighting, committed, engaged, professionals, and really dedicated to that, my hope is even bigger. So the future is on you, on your hands, but you are the ones that as well need to design it, and I'm very confident that you will design it on a very good way. Count on us. We will be there to support you, and of course do whatever we are not able to do. We count on you. Thank you so much.
Thank you, Dr. Maria, for your kind, encouraging words for all the youth. Hopefully, this enthusiastic message reaches to the all youth who are concerned. Next, we're going to be having a speech by the Minister of Youth and Sport, Dr. Ashraf Al-Subhi. I think there's a problem with the connection, so we're going to move to the next section. We're going to be having now the recommendations by the youth by Mohammed Isa, Climate Change and COVID-19 Youth Assistant for Climate at World Health Organization, Egypt. Please welcome him.
Okay. So hi everyone, and thank you so much, Samira, for the moderation, and thanks to all the speeches that has been delivered already. So now we'll be presenting some of the recommendations that we have collected from hundreds of youth around the world throughout 2 virtual sessions on the Global Youth Forum on Health and Climate Change, throughout the Conference of Youth 17, the preceding COP27, and throughout even a forum that we have shared with the virtual participants so that they can still feel the inclusivity and still feel they are part of the process. So our recommendations, or the recommendations collected here, they were based mainly on the thematic days and their interlinkage with climate change and health. So we can go to the first slide. The first slide, yes, okay. So in terms of finance and regarding its linkage with climate change and health, what did the youth want? They wanted a dialogue for the identification of the limitations by the governments and to identify the needs and solutions from the youth sides. In addition to more easily accessible health and climate change research and their interlinkage with financing as well. In addition to a climate finance with a focus on sustainable healthcare facilities, loss and damage fund, which is still lacking in the outcomes of COP27, organizations providing climate solutions and government policies geared toward climate solutions, and One Health initiatives. In addition to raising awareness through social media and fulfilling the commitment of the $100 billion that was still as well not fulfilled by the developed countries to the developing countries, in addition to investment in the green economies and phasing out of the fossil fuel industry and moving or transforming towards the renewable energy subsidies and engaging the private sector as well in order to ensure the inclusivity of all the stakeholders. Next. In terms of the youth, what they wanted as well for themselves, they wanted mentorship, internships, and coaching in order for them to develop their capacities further with opportunities by other stakeholders. Again, raising awareness, and we will be seeing raising awareness several times throughout the slides, which shows the importance of education, developing capacities, and the importance of evidence in order to make informed decisions, in addition to providing opportunities to research upon the effects of climate change on the health of young people, inclusion in the policy making and decision making in negotiations, and providing their recommendations regarding what should the outcomes be of the different COPs, and also regarding the implementation outside COP, in addition to technical and financial support for youth-led organizations as well. Next. So regarding decarbonization, more climate finance dedicating to decarbonizing the healthcare sector, especially during COP26, there was the COP26 health program and the commitments by the different countries regarding the resilient and sustainable health systems. So there would be need for more climate finance on this, transition to renewable energy resources, economic tax on emissions, joining and endorsing the Fossil Fuel Non-Proliferation Treaty, which has also been supported by the WHO and several other organizations as well. Again, awareness, again promoting research and development, and governments and cities working on green spaces and enhancing carbon storage in the different areas, and as well working on all the aspects of the economy and different sectors in terms of decarbonizing. So it's not just about the healthcare sector or about a certain policy in mind, but all the policies should focus on their decarbonization as well. Next. In terms of agriculture, working on preventing the deforestation, creation of guidelines for sustainable agriculture, again education awareness raising, plans towards reducing the agricultural waste, providing more resources and support to the farmers, especially that we have a constituency focused on this within the UNFCCC as well, switching to plant-based diets in addition to the focus on food systems as well, especially that also the Cornevia Joint Work on Agriculture did not as well fulfill the required commitments in COP27, research and also consultation on agricultural practices and what can be done better by all the relevant stakeholders. Next. regarding the gender, again, policy dialogue and capacity development, and gender equality as a principle. It's not just an outcome that we should focus on achieving in general, but it should be present in all the policies as well, and incorporate gender perspective into different policies, again, raising awareness, opportunities to engage and provide input for the different genders, support grassroots organizations targeted at empowering women, being one of the most also vulnerable groups or the gender that's present in more vulnerable settings, building infrastructure and integrate the need for supporting women and girls in basic school, university, and formal education in general, even non-formal education as well, regarding their capacity building. Next. In terms of water, obviously, again, raising awareness, and also working on reducing the water pollution, regulating the private recreational use of water and promote better rain collecting systems, research, conservation of marine resources, enforcement of good water management systems, increasing the quality of the hydroelectric power generation, and focusing on the wash as well, which is very important in terms of tackling the water from the different perspectives when it comes to climate change and health. Next. Civil society, allow more civil society participation spaces and meaningful engagement in decision making, which is supported by the ACE, the Action for Climate Empowerment document that was produced for the COP27, collaboration and partnership with the different governments, grassroots solutions spearheaded by civil society organizations, the non-profits should be encouraged and funded, regular consultations ahead of the COPs, ahead of the regional climate weeks, and even outside these settings, and of course also providing financial support for the implementation of activities. Next. In terms of energy, obviously transitioning to renewable energy sources within every aspect of the healthcare sectors, awareness raising of the relevant stakeholders, fund renewable energy transition projects, transfer to green technology and capacity building, training and research innovation should be tied to local research institutions and non-governmental groups, and support for poor households to adopt the energy transition as well, in order to make sure that the transition to renewable energy fits everyone and is present in every sector and setting. Next. In terms of biodiversity, adapt with the ecosystem by reducing non-climatic stressors such as pollution, overexploitation, habitat loss and fragmentation, awareness raising, monitor the biodiversity of the regions and take immediate actions against unexpected drops in population of some species, expansion of green areas, limiting exploitation, increasing the size of natural reserves, and proper management of the natural resources to ensure that our exploitation is a safe one that protects our biodiversity and protect us of the triple planetary crisis, which is pollution, biodiversity loss, and climate change. And yes, together for implementation. So regarding what are the actions and what are people looking forward to ensure that the successes or the activity that has been initiated in COP27 to proceed also to COP28, increasing the educational intervention, increase the engagement of the youth, and luckily also we have with us the COP27 Youth Envoy, and we have seen that in the cover decision it has also been mentioned to follow on this idea or this initiative of having a youth envoy for every COP. Educational sessions for youth from the basic to advanced to increase their capacity. Involve CSOs at national level, so for for people who are unable to attend COPs, they can still contribute to decision making. Involvement of youth in activities pertaining to climate change, when climate change and including youth online and one-on-one or in physical or in-person settings. Network of youth to champion the climate change, and repeating and progressing with the Global Youth Forum on Health and Climate Change for the years to come. So these are all activities, these are all initiatives, these are all the recommendations by the different youth, which we hope would be implemented further during the next year and for the next youth forum ahead of COP28 to further provide more recommendations and even more successes by the youth as well. Thank you.
Thank you, Mohammed, for explaining the youth statement that was that shows the efforts of all the youth who contributed in this statement. Hopefully in the next years, in the next coming COPs, we see more youth and more statements are delivered to the leaders of the world. Next, we're going to have some reflections by Nisreen Elisalam. Okay, we're going to be having reflections, by COP27 Youth Envoy, Dr. Umayna Al-Umrani.
So hello everyone. First of all, I'm always super happy to be back home in our pavilion. And yeah, I think today is a celebration. For the first time ever, we have the Global Youth Forum that focuses on health, climate change, and the needs of young people. I think this is one of the first and the most special milestones that we have here at COP, because we say that this is the Youth COP. We have the Children Youth Pavilion. We also have, for the first time, the Youth-led Climate Forum. And I'm so proud to say that even with the health community, we're able to dedicate an entire consultation for the first time during COP and in the lead up to COP, focusing on health, environment, and young people's needs. I think that as the health community, we provide the powerful health argument that is needed to protect the health of the current and the future generations. When we're talking about our physical health and how we are seeing now more than ever impacted from the cardiovascular diseases and the respiratory diseases that we see because of the air pollution, from the acute food and water insecurity, which is the most prevalent that we see here in Africa. And we also look at, most importantly, the mental health impacts of climate change, especially on us, on the younger generation, because we feel anxious, worried about the future, and at the same time, we are trying to be included in the decision-making process. But I'm also very happy to share a few reflections around the key outcomes from this very powerful and robust consultation, because we have the untapped potential of really empowering young people from all the different disciplines to use the health evidence for climate change and for urgent climate action. This COP, we say that this is an implementation COP, and as the COP27 presidency, we meant it in every meaningful way. And me as a young doctor and also as the youth envoy, we work together with the presidency to provide a robust evidence and to really empower our agenda when it comes to placing the priorities of Africa at the forefront and the priorities of the most vulnerable. This is the first time ever at COP that loss and damage is an agenda point, and this brings in the importance of how we see health as a priority, how we see the resilience and the capacities of our healthcare facilities, who are always at the front line when it comes to any climate-induced catastrophe, and we need to prioritize the resilience of our healthcare facilities, the capacities of our healthcare workers, and at the same time really push our nations not to backtrack on their promises and to really invest in our health and the health of the planet, which sustains us. And we as young and children, adolescents and youth, we are the agents of change, and I really mean that. And I don't think that we are the leaders of tomorrow, we are the leaders of now, because we are already leading the actions on the ground. We are participating in consultations like this, really pinpointing what we need. We need to build our capacities, we need to work together across all the different disciplines, we need to really fight for placing our health, the health of the children and the young people at the heart of the climate negotiations, because only then we can achieve climate justice and intergenerational equity. So thank you.
Thank you so much. Now we're going to be opening the floor for everyone, for all the youth to contribute. If you guys have a question, if you would like to ask a question, I mean, say a comment or anything. Anybody wants to contribute?
Thank you so much for this space. As a youth representative from Latin America, we are so proud that this kind of spaces, especially in health area and scientific area, can be shared with the young people, because like the majority of youth in Global South, we think that the innovative ideas come from the young generations. And that exists thousands of proofs about that, but we need to continue include to the people that have a brilliant ideas, have the talent especially, but need more investment, for example, with education plans or information or even education programs that can contribute, for example, to create the next medical doctors, the next researchers in epidemiology. We have that potential, but we need to support more to the next generations in that area. And thank you so much for give us this opportunity. Thank you.
Hello everyone, my name is Priyanka Chahal. I'm a final year math student, and actually special this session is on health and the youth at COP27. It is interesting for me, and I speak on the experiences being a medical student. I have seen that when I was in the second year of math school and studying in a country which is a developing country, and when I talked about, hey, climate is affecting the health of pregnant women, and we all know, we all are the health related people here, so we all know the physiology and everything related to that, right? I have faced a lot of challenges even in the math school, where I will start raising the awareness, founded an organization there, so people can contribute, not people, I would say the medical student. So there must be something in our curriculum in the medical school that even the medical students can know that why this is important now and how. We have many organizations, of course, but the organizations which are small on the grassroots, there should be proper collaborations with all of those organizations, and especially the involvement of these math students, which are out of the range of the big network of the health. So my point here is that actually, we need to act now, and the health and the climate is a big issue right now. We see all the stakeholders talking about the climate on a bigger level, and we talk about the climate finance and many things, but where is the real deal? Have you seen the people who are living in the rural background, what is happening with them? They don't even contribute to this climate change, and we don't even provide the facilities of health to them. So there were many things, and I'm a global health researcher, being in a math school, so this is a big issue here, and we need the more involvement of youth in health, especially who are all the health-allied students studying, and of course we all need experts them to provide the mentorship as well. So that's just my point, and I personally encourage all the students of my age or my community that this is a big topic here, we should have to act now, and this is a great platform by being here at the COP and meeting all of our community by being here, and it's a proud feeling, and my last message is just that, the involvement of youth everywhere is important, but when it comes to health, we are just not the activists, we are also the professionals. So the professionalism and activism, they should be in a combined state, so we can execute and to empower others as well in the health field. So yeah, thank you so much, and thank you for listening and providing me time to give me a mic.
Any more comments or questions?
Thank you very much. My name is Crispas Memaho, and I'm from Uganda. I'm a medical clinician, and I co-found a youth-led organization. And I work with internally displaced people in Uganda, in Western Uganda. And our main focus is on mental health awareness, because as much as we are pushing things like loss and damage, I think it is the same energy we should be talking when we talk about health crisis. And I'm saying this because I have vivid experience working with people who are displaced. I've interacted with them, and I've seen how they are in a health crisis, and how a country like mine is in a health crisis because of climate change. So I think this is a very good start to see that health is also being talked on, like at the COP, but we really need more capacity, and we really need the voices of those people who are at the front lines, who are the most affected. Because I usually ask people, if you're solving something without people who are very much affected, then what are you doing? The same manner is the way these people who are at the front lines are the very people who are facing a lot of health challenges, and we need their voices, we need their say in everything that we're doing. So for me, my question would be, how is WHO trying to engage people like myself, communities like where I come from, to see that their voices, their health needs are heard in these, platforms? Thank you very much.
Sure. You want to add on that? And then we go to Christina.
Hi everyone, I'm Gokul from India. And yeah, I want to add something like youth voice is really important, and also youth perspective is also very important. So here I am representing the indigenous medicine right now at COP27, something which is not being recognized before this COPs. Yeah, this is the first time we are being represented. And something I would like to say is that WHO should take more efforts to make awareness about indigenous medicine as well, because there is a need for our indigenous communities there, but most of them are not talking about their medicine. Their indigenous medicine is something very much important for the future as well, for the biodiversity itself. And yeah, something that you guys, everyone should acknowledge, and it's not being done, and it's really fading away. This is something I would like to add on with this, but because Youth Voice is right now taking this forward with Yango Health Working Group, we are taking this forward. For the first time, we did an intervention at the European Union Commission Pavilion about antimicrobial resistance and traditional medicine, and which was really WHO told us they will consider us in the future as well. Yeah, indigenous medicine is something we guys are forgetting, and we need to acknowledge. Thank you.
So clearly I'm not youth, but I am enormously inspired by everyone that spoke today. I'm inspired by the energy. Omnia, you are so right when you say we are not the leaders of tomorrow. We are the leaders of today, of right now, and you are, absolutely. So it's wonderful to see this energy. It's wonderful to see it at COP27. COP27, of course, as you know, will also be followed by another conference of the parties. We've got a triple planetary crisis. We need youth to tackle it from all angles and to say this triple planetary crisis is a health crisis. So we're doing that for climate change. We need to be doing that next month for biodiversity. And we had a youth speaker here. We also had some youth speakers, indigenous youth speakers, on an earlier panel. So thank you for raising the importance of indigenous knowledge and traditional medicine. You'll be happy to know that WHO did establish a global center for traditional medicine, so that is done. There is leadership in that area, so I'm sure you're very excited to hear that, and I'm sure there will be many opportunities for youth to engage. In fact, there are already many opportunities for youth to engage. A lot of terrific youth have come and done internships. We rely on your research. We rely on youth for engagement and advocacy, and to help us co-design. So anyway, I just want to say thank you.
Any more youth would like to share their opinion or questions?
Thank you so much. Hello everyone, my name is Iris. I am a medical doctor from the Netherlands, currently doing a PhD at the London School of Hygiene and Tropical Medicine. Also was incredibly inspired by all the interventions today, so thank you for inviting us here and sharing that with us. I think my intervention will be a call to, all of us here, youth and older generations as well. Right now we're having this incredible event and we're talking to each other about very important points, but the decision making is ongoing outside of this area at the moment. And I think a lot of us in this room are probably not the most satisfied with the current status of the outcomes of COP27. So when we're thinking about these outcomes, I would like to call upon us, everyone here, to, when we are in preparation for COP28, which will start the day that we return back to our homes, let's start talking then already to those that will negotiate and make the decisions at COP28 next year, so that we can ensure that our opinion will be part of the outcomes next year, and we will have more ambitious, well, I'm still hoping for ambitious outcomes here as well, but let's do that, and I think all of us can collaborate and work together to ensure that we can make that happen, so that the youth voice is not only shared in the spaces outside of the actual decision making, but is actually part of the decision making. Thank you.
Any other youth would like to add anything else?
Okay, thank you. I am Ibrahim from Sudan. I would like to mention that youth is their role is very important in the community, and what they face, the obstacles and the problems they face, as leadership in the less developed countries, they face the leadership skills, and they just find themselves, there is no one to guide them in order to do all the projects that related to health and the local communities. But they are the power of the future, and if there is exchanging knowledge, leadership skills between the youth worldwide, they will get benefit and they will succeed. And thank you.
Thank you, everyone. I would like to invite Nisril Siam to the floor to share some words with us.
Thank you. I am actually very happy and honored to be at the WHO Pavilion for the second time. My name is Nisreen Al-Saim from Sudan, and I'm the chair of the UN Secretary General's Youth Advisory Group on Climate Change. So basically, I was here before talking about very important topic, which is, I think, also we need to re-highlight it, which is the mental health problem and the issues related to climate change itself. When we talk about climate change and specifically climate crisis, most of the thinking goes to the rehabilitation of the houses that was destroyed by a hurricane, for example, or by a flood or something else, but it doesn't talk about the mental health of the victims of these climate crises. And not only that, but the mental health of the young people who are here now holding all of the burden, not only to save themselves, not only to save the community, but also to save the whole planet. And I think it's very heavy burden that we as a generation who did not actually cause that problem, but now responsible to solve this problem, are carrying every day. I know Omnia needs to take like a 3-month rehabilitation process after this COP. And she always talked to me, I was like, Omnia, keep eating, keep drinking water, because you'll collapse one day. And she's only one person, but there's hundreds of other Omnias in other places who are working day and night, and they don't have time even to take care of their own health, whether as like health, or their mental health. So the other topic is the role of young people with climate change health nexus. Unfortunately, in the most vulnerable countries to climate change, when we talk to climate change and health, normally we get only solidated with public health workers or officers. We don't get consolidated with doctors, with hospitals, with the senior levels when it comes to the medical care. And this is a huge problem, because now climate change introduced new carriers of different diseases. So we are actually talking about new diseases in new areas. It might be not new disease, but it was not known in this area. So there is actually there's mobility when it comes to people because of climate change, but there is mobility also of diseases and carriers of these diseases. When we have a flood in some area, and most of the times we normally have waterborne diseases after that, malaria, bilharzia, cholera, and many more diseases that linked with sanitation, get mixed with water, and etc., etc. The water quality, the air quality, all of these things are very much deeply linked to climate change and deeply linked linked to our diseases too. So it's very high time to have climate change embedded inside of the health policies of the countries, and we stop receiving only public health officers in the meetings and the awareness raising conferences, and in these meetings to have doctors, to have senior level management when it comes to health, and hopefully one day and very soon to have a young senior managers, because we have a lot of young doctors, but how many doctors we have in the senior level, in the leadership level, this is also a very big question when it comes to youth leadership. Especially with being doctors and the medical field, I know there is certain years you need to spend to become something, but especially now with technology, with knowledge, with the internet, a lot of things can move faster, and we are in the speed generation. We are talking about 5G now. I mean, even 3G, 4G is not working for us. So putting us in the place where we make the decisions for our future and our past that we deal with, and the problems that we are dealing with specifically in health as young people, is going to be my key ask for today. Thank you very much, and I'm very happy and glad to be here again one more time. Thank you.
Thank you. I would like to invite Mr. Mustafa Azzil Arab, Associate Minister of Youth and Sports, to give us some words.
Hello everybody, good afternoon. First of all, on behalf of Minister of Youth and Sports, Dr. Ashraf Subhi, he's sending his greetings to all of youth which attended here today, and Her Excellency Dr. Naima, thank you for inviting us. Dr. Ashraf Subhi appreciates this idea of this forum, and he pointed me to follow up all results and outputs of this very important event. The crisis of climate change affect and directly on health, by disease, by death, maybe by flood, all food security, all this affected by climate change. So gathering all these young people here and thinking about that is very appreciated idea. Also, we have done a lot of work together with Omneya, my great co-partner. We worked too long on COP27 youth work and youth inclusivity. We worked on COI, we worked on Youth Day, we worked on accommodation, we worked on negotiations. Everything we have done here, we have done it for youth, for future generation. And in Egyptian government, we worked for a lot of programs. We aimed to make sure all youth voices will be heard in the negotiations and with the decision makers. Also, we worked on local level, especially with UN. We worked on more than 30 programs about education, about youth engagement, about youth capacity building. All this, we can see some of our results here today, but the challenge what we are going to go through the coming days, the challenge is continuing our work after the conference. In Egypt now you can see we have a very wide awareness about climate change, and a lot of Egyptian youth now we can say they are engaged in the work about climate change. So the coming days will be different for Egyptian youth, and I think will be also different for youth from all over the world who participated in COP. And I think this year we have a very distinguished participation from all over the countries in COP27. And now we can say we have an Egyptian legacy. We have first Egyptian and first youth envoy. She is Egyptian girl from Egypt. So the next COPs will witness more inclusivity and more engagement for youth in COP process. That's all. And last but not least, I'm thanking Dr. Naima for all support which she provide for youth and young persons, and welcome to continue work after COP in Cairo. Thank you.
Thank you. I would like to invite Dr. Naim Al-Qasir, a representative of World Health Organization in Egypt, to share some words with us.
Good afternoon. I am usually saying I am having the policy in my office
as a World Health Organization representative in Egypt, but before in Sudan, and before that in Iraq, and before that in my country, Bahrain. Always have been by youth, with youth, for youth. Today, every single person who stood here gave us a message. And I'm always saying, usually I'm a silent observer. I was honored to join Mohammed when he was doing the climate change, the youth forum. And Dr. Omnia Omrani, with her kindness, humbleness, even before she became the envoy, having us, teaching me, right? Teaching me, Mohammed teaching me all about COP27, COP26, 25. Learning from them, actually, and putting the vision of this country, of the World Youth Forum, on how we as individuals should be protecting ourselves, our families. Today, I'm very humbled to say, still learning from you, whether Dr. Omnia, Dr. Nasreen, Dr. Mohammed, the youth who stood and spoke. There are three messages I have. One, you are the leaders. You are, and we are learning from you. Two, in order to be at the COP28, you have started. You are not going to start. You have started from here. And I have seen the start. The young lady in the back, when she said, after we go home, what I have witnessed here, that you have started. And this is a lesson from us. We, the older generation, this is intergenerational, we go and you say, we need a few days of rest, we need to take vacation, and we will start. But what I have seen here already started, your networking. I'm very proud to call upon a young lady here, Dr. Muhandisa Samira, Engineer Samira. She is from Oman. She is heading the delegation of youth. She is an engineer, and she has at the same time came here to be at the part of health. Dr. Omni and Dr. Nasreen talked about multidisciplinary, multi-sectorial, and community engagement. My pride comes that today in this Global Youth Forum for Health and Climate, we are talking about inclusiveness, inclusiveness from the diversity of colors, of looks, of gender, of education, and engineers have a major role. We have a line behind us talking about fresh breath air, how to protect. So I'm proud that we managed to bring not only physicians and nurses, but beyond, because health is a multidisciplinary, multi-sectorial. So we learned together. Dr. Nasreen said we want the health young voice to be at the heart of decision making. You heard the message of Dr. Maria Nayera. You heard the message of the WHO Director General. This was his wish, that by COP27, we have a global forum on youth and health. The Global Forum for Youth, Health and Climate Change, and it's happening. We learned from you, protecting our biodiversity, protecting our communities, and again, somebody stood and said how we engage the communities. We are doing it, you are doing it. You already said it. So please, let's work together. We learn from you. I really would like to hear from you, the people who are learning online. We would like to thank two excellencies, Ministers of Health and Population in Egypt and Minister of Youth and Sport, for believing in youth, patroning this initiative, and at the same time, commitment demonstrated to be with us, to be with you. By that I mean, not only the virtual, not only the start. I don't know how many of you attended on 10th of November, where His Excellency Minister of Health and Population, Dr. Khaled Abdel Ghaffar, said, be practical, let's achieve, share at COP28, what did we do? And this is for us a challenge, for you more challenge than me, but for us it's also a challenge collectively we work. Thank you very much for being here, to be with us and sharing your ideas, your views on how we protect ourselves and our planet.
I'm very happy as a young Omani woman from Sultanate of Oman. And at the end of this day, I just want to congratulate all the youth who are part of this. And I want to thank the Republic of Egypt for the great success of this edition of COP27. From Sina, the land of peace, and Egypt, the mother of the world, We come here for our planet, from all countries, sectors, and cultures. Together, we will be stronger with our desire and aspiration for a better planet. I wish you success and have a good day. Thank you.